going to move faster. In order not to waste your time this morning, because we still have many activities to do, two of us are from Ibadan here. Dr. Ilori is one of the grantees, and he will be presenting one of his reports at the conference. So I want to thank the Nairobi team for working very hard. It's not all that easy spearheading this kind of agenda. And I remember many of those meals up and doing has gotten us to this stage. So I want to thank the University of Nairobi for accepting to host us and also to take the lead. I want to congratulate every one of us for being part of this historic occasion. Thank you, and God bless.
Thank you, Professor Jagende. We are grateful, and of course, when you go back to Ibadan, you send our greetings. Now, Makerere University, Professor Damaris Nakajako, please welcome.
My name is Professor Damari Nakanjako. I'm Professor of Medicine at Makerere University College of Health Sciences, and I'm the Principal for the College of Health Sciences. Our chief guest, the Vice Chancellor, and all academic faculty here, Arua Secretary General, the Council of Governors represented, all our partner universities, patients and caregivers here, all protocol observed. Ladies and gentlemen, good morning. It is my pleasure today to be here at this launch of the Arua NCD Center of Excellence. From the College of Health Sciences, I'm here with Dr. Innocent Besije. Please stand up for recognition. He's a family physician and senior lecturer at the College of Health Sciences. I'm also here with Dr. Isaac Sinawulia. Please stand up. Dr. Isaac Sinawulia is a consultant cardiologist at the College of Health Sciences and Heart Institute, and they're here to be part of the launch of the NCD Center of Excellence. So briefly about our College of Health Sciences. This College of Health Sciences has 5 schools: the School of Medicine, the School of Public Health, the School of Biomedical Sciences, the School of Health Sciences, and the School of Dentistry. And these together work as multidisciplinary teams to address NCDs, among other challenges to global health. So we have different teams at the College of Health Sciences: cardiovascular disease teams, the pulmonology teams, the teams on malignancies, the trauma teams, trauma center, the nephrologists, the public health and community engagement teams, and also a team looking at interactions between NCDs and infectious diseases. And these are well aligned with the themes of the Center for Prevention of NCDs and early detection and control of NCDs, using the different approaches, including the multimorbidity, data science, and health system strengthening approaches. And we have different capacity building programs in all these themes, including master's students, PhD students, postdoctoral scientists, and early career scientists, to really build capacity in this emerging problem of NCDs. We shall have a dissemination meeting and our 2023 NCD symposium early next year, so please look out for the dates, early Feb and March. These will be shared with you, and we invite you to join us both physically and virtually. We'll share with you the dates shortly. But for today, really, I want again to say that I thank you, the team at University of Nairobi, for taking the lead role and bringing us together for this noble cause of the Arua NCD Center of Excellence, and from Makerere University as a College of Health Sciences. We are really happy to be part of this movement, and we are set to take it on with our multidisciplinary teams to handle this as an emerging problem, which is not only for health, but includes all other disciplines to support it. And as you know, you are not protected until all of us are protected. So I thank you for listening, and we're happy to be part of this. Thank you.
So thank you, Damaris. I would like now to invite Dr. John Fabian, University of Witwatersrand in South Africa.
Thank you, and it's a privilege to be here. Thank you for the invitation, and to all our esteemed guests. Good morning. From South Africa, we would like to send you greetings from Professor Zeblon Vilakazi, who's the Vice Chancellor of the University of the Witwatersrand, Professor Lynn Morris, who's the Deputy Vice Chancellor for Research, and also to Maria Papathanasopoulos, who's our Dean of Research and Postgraduate Affairs in the Faculty of Health Sciences, who unfortunately was not able to join us today. It's also WITS's centenary, so WITS is 100 years old this year, of which we are very proud. And it almost feels quite timely that we are here as part of Arua in our centenary year, and hopefully it will be the start of something that develops with time and is sustained for many more years than we can imagine. It feels like with every person who comes to talk, we are all saying the same thing, and we're all giving the same message. So I'm going to try not to do that again. But I think there are some elephants in the room, and it's important for us to acknowledge this. And one of them is that health is really hard, and making our populations healthy is really hard. And I think we need to provide our own solutions, but in order for us to do that, we need to know what those problems are. And our approaches need to be a lot more nuanced and a lot more complex than just focusing on physical or mental health. I think COVID has taught all of us about the importance of mental health, especially in our young people. But I think we also have a nexus of non-communicable diseases with communicable diseases, and COVID again was a perfect example of that. Although it was an infectious disease, the people who were most vulnerable to COVID were people with diabetes and hypertension, for example. And I think we have a lot of other infectious diseases that affect our populations that aren't relevant in high-income settings, and those we also have to address. I think the other thing is the bench-to-bedside approach isn't enough anymore. We need to understand the genetic biodiversity of African populations, which is totally underrepresented in global science. We need to look at big data. We need to look at the behavior of people and how we can change that. And for that, we need the social scientists on board. It's not good enough to just have the medical scientists anymore. But on top of that, we need research capacity development, which is really hard in our setting. I'm thinking of South Africa with power outages, just keeping biobanks and freezers and backup generators going is a really hard task to achieve well. And I think health system strengthening is another thing that we all talk about, but it's a really big problem. We operate in silos. Patients get sent to a hypertension clinic, then they get sent to an HIV clinic, and then they get sent to a diabetes clinic. We have to change that. We have to make it easy for them to access healthcare. And we also have to give them access to healthcare that will make an impact in their lives and change their lives. And I think those are all the things that we need to address as part of the science. So it feels quite daunting sometimes and quite overwhelming, but we can do it. And as many have said before me, we can't do it alone. But we can do it if we work together and if we have good leadership, if we have a common vision, and of course, if we have the appropriate funding as well. So thank you to the funders. WITS is proud to contribute research that has an impact in patients' lives, and that is a gateway to changing their lives for the better. And we also need to focus on training the next generation of global leaders, and that also needs to be our focus with Arua. So thank you. WIT has lots of strong groups doing non-communicable and infectious diseases research, and as one of the spokes, we hope that we will support the hub with Fred as the leader, as appropriately and as strongly as we can. Thank you.
Thank you, Dr. Fabian. Now, I wish to acknowledge the presence of Dr. Fantas Mene, who is representing the Director General, Minister of Health. Fantas, you're most welcome. We've heard from our guests, but from these universities, who are our partners, there are also other members of the university that accompanied them. So we have the University of Ibadan, just the ones at University of Ghana, Amakara University they mentioned. Then we have WITS is one, but we also have the University of Lagos. University of Lagos? Yes, University of Lagos is, thank you. Now, I would want to move to the next session where we invite one of our partners from the UKRI, Professor Pascal Matthew. Pascal is going to join us online. IT. Professor Matthew.
Hello?
Yes, please go ahead.
Perfect. Can you hear me?
Yes, we can hear you, Pascal. We can hear you.
Fantastic. Thank you very much for the nice invitation. It's an honor and a privilege to be here and representing the University of Glasgow. I'm here representing the principal, the vice principal for engagement, and also the head of the College of Medicine and Veterinary and Life Sciences. The University of Glasgow is one of the oldest universities in the UK. It was founded in the 1451. It's part of the Russell Group, which is the elite of the universities within the UK. It's the home of 7 Nobel laureates and the top 100 universities worldwide. This is a research intensive university. We are in the top 5 within the UK for research income, and we have several research beacons which are perfectly aligned with the activity of the Arua Center of Excellence in Non-Communicable Diseases. We have a strong focus on medicine, chronic diseases, One Health, and addressing inequalities. We have also very strong connection with industry partners. With them we have created several centers of excellence, including the Imaging Center of Excellence and the Stratified Medicine Scotland Innovation Center, which again are fully aligned with the activity of the Arua Center of Excellence. We are an international universities with several links with international partners. We are founding members of the Guild, European Research Intensive Universities, and through the Guild we are strengthening our collaboration with Arua. The collaboration with Arua is an absolute priority for the University of Glasgow. It's strong and solid and has been led in the last 5 years by our Dean for Global Engagement with Africa, Paul Garside, which is also connected today. And we want to make this collaboration stronger in the field of non-communicable diseases. And this will be done through the College of Medical, Veterinary and Life Sciences that I'm representing today. This is the largest college within the university, composed of 8 different schools with a strong interest in non-communicable diseases. I represent the School of Infection and Immunity and also the School of Cardiovascular and Metabolic Health. And with the aim to make our collaboration stronger, we are organizing a next meeting in Glasgow of the Arua Center of Excellence on Non-Communicable Diseases. This is part of an initiative funded by the Erasmus International Mobility Scheme. We will be hosting representatives from the University of Nairobi in Kenya and Ibadan in Nigeria, and we will be discussing for 2 days on non-communicable diseases. Once you have finalized the program in the flyer, this will be circulated to all of you, because you are all welcome to join us and meet some of the key players in non-communicable diseases in the College of Medicine. But also within Scotland, we will be inviting representatives from other Scottish universities within Europe, where we are leading some connection between basically digital health, large programs, and Arua. Thank you again for inviting us. We are very keen to collaborate more and better with the center. I had the privilege to be also invited in the first meeting that has been already cited by several of you in Accra, and since then I've already collaborated with few of you. So thank you so much, and I wish you all the best with the Center of Excellence.
Thank you, Professor Naipia, and also our greetings to Professor Galsen, University of Glasgow, who also visited the University of Nairobi as we were beginning the center. We truly do appreciate your support. Also, greetings to Christian. Now, Pascaline, we have also have our funders, the UK Research and Innovation. Charlie Wallace. I'm not sure whether she's online. She's not online yet. So, with us here, we have caregivers of patients who have NCDs or who have experienced NCDs. We also have the patients themselves, and we had a session with them. We wanted to speak with them before we began. Now, we have a short video which we would like to just acknowledge what it means to have an NCD, or what it means to really have to take care of a person with an NCD. And many times for us, we say, sometimes we see the face of the patient, but we don't see the face of the person taking care of the patient. So this is a day that we really wish that we need to give more attention to the patients, to the healthcare systems, to those people who are taking care of the patients, and remember that some of them could be children who are taking care of their adults. And so we see reversal of roles in terms of really who really takes care of the patients. So ICT, with your support, we can play the audio just to know what it means to walk the journey of having an NCD.
When I was sick, my neighbor told me that there was medical camp near the railway club. And I went there, and I was diagnosed this problem of heart by some doctors. And so the doctors told me to wait for academics because my heart was not beating properly. My family was very, very, very much cooperative because without them, I could not manage. Even today, you find I'm from yesterday on Wednesday, and even today I was given some transport to come to the town. You see, so my family has been, and especially my wife, has been very cooperative because when I was sick, this heart problem started with the blood pressure. So blood pressure at night, I could not sleep. But my wife tried by all means to help me.
My name's Diana Swan. I have a heart condition since 2018 up to now. My experience has not been easy for me, but I thank God. He has been enabling me each day. And then my challenges in this condition are on the side of drugs, attending clinics. It has not been easy. Mostly when you have financial problems, you cannot be able to make it. There are some people outside there who are going through such situation and they are not able to reach even the clinics to have drugs, but there's no one to help them outside there. If the government can intervene to help them through the NHIF card. At the time that I was found with this disease, the condition, I was at Kenyatta National Hospital, and I think because of the doctors are not enough, the appointment, I was not well, my condition was not well, but at that moment I was given the appointment of the next month, which my condition was not well, and for that is why I'm saying the doctors are not enough. If the government can do something about the doctors to be there, at least to help at that moment. Some of the challenges I've been going through is cash. If we do not have cash, on the side of drugs, attending clinics, it is not easier. It is not easier because if you do not have that cash, you will not be able to have drugs. And it's like without drugs, you can't do anything. You are just there like a disabled person. So I depend to these drugs so that I can move, so that I can do one or two in my lifetime. That is one challenge. Another one is to attend clinic. You can be given an appointment to attend clinic, and by that time, you don't have even fare to take you there. Consultation fee, sometimes it is high. It has been hard for my family because the drugs are very expensive, and for my family, they're not well enough to afford the drugs. And also, I'm a parent, I have kids, I have to take care of them. With my condition, I cannot work right now.
This NHIF, National Hospital Fund, Insurance Fund, is not serving really the good purpose because it is not affecting even the drugs which we get from chemist to buy, because the doctor can just prescribe, give you the prescription, then you go to the chemist and buy from your pocket. The policy is not helping ordinary people because the policy does not cover the whole people. For example, you pay 500 shillings every month, but at the end of it, if you go to the hospital, you have got a very serious disease like this one of mine, cancer or what, it doesn't cover. It covers only these small treatments like malaria, small thing or coughing. That's what it covers.
So thank you, ICT and corporate, for support. We truly appreciate. Now, the journey of really having an NCD is not an easy one. Would like to acknowledge and appreciate our patients and our caregiver. Larry Onyango, you may stand where you are. We just applaud you. Larry Onyango. He was here. I'm not sure, he might have stepped out. Stella Kimani, our caregiver, one of the caregivers. The journey of taking care of patients is not an easy one. And many times, by the time they're done with caregiving, they themselves have an NCD. It's really an issue that we need to really think about as a society and as a nation and as a world. Now, we move on to the next session. We're going to get remarks from Dr. Emmanuel Wamano. Dr. Wamano is representing the Council of Governors. Dr. Wamano, kindly welcome and thank you for coming.
Thank you very much. A lot of people who have spoken have written on existing protocol, but because I speak after a video, kindly allow me to establish new protocol. So, representatives of the Director General of the Ministry of Health, Dr. Murray, representative of the Vice Chancellor of the University of Nairobi, the University of Nairobi leadership, leaders in the leadership of the Arua Center of Excellence, various development partners, those here and those online, distinguished members of academia from various universities across the world, ladies and gentlemen, all protocols observed, good morning. We come here today after we just about a year ago came out of the COVID experience. And in this part of the world, we also have had a number of communicable diseases that we've dealt with over the past several years. And our hope is that we can foster some of these lessons that we have learned, that we are good at in dealing with infectious diseases, to reap gains when it comes to non-communicable diseases. I'll make a few remarks on behalf of the chair of the Health Committee at the Council of Governors, His Excellency Governor, the Governor of Tharaka Nithi County. So first and foremost, let me take this opportunity to thank the organizers of this meeting for both convening it and inviting us to this very important forum. I also thank all of you for taking time to join us in this important forum and being part of the solution when it comes to non-communicable diseases. As such, on behalf of the Council of Governors, allow me this morning to take this early opportunity to say to you, thank you. Asante sana. Ladies and gentlemen, more than a quarter of all people who die from NCDs do so during their prime years. As such, alongside each of these sickness, suffering, and death, millions of families are pushed into poverty. Sometimes, this is because the breadwinner becomes too weak to work. Other times, it's because the family has to sell off productive assets in order to pay for medicines and treatment costs for the sick. but also it could be because the breadwinner is forced to stay home and take care of someone else who is sick. All these things take a large toll on communities and families. On another note, NCDs also take a big toll on governments, both at the county and national level. NCDs affect the productivity of the workforce, and therefore the private sector cannot be left behind in this debate. The thing is that this is not a community problem. This is not a government problem. This is not a private sector problem. This is a problem for all of us. Ladies and gentlemen, in this context, we all need to pull together as we strive to turn the tide against non-communicable diseases. We need to continuously engage individuals to make smart choices when it comes to protecting their own health. We need to ensure that businesses produce healthier and more sustainable goods, services, and environments. We need the academia to generate new knowledge, insights, and evidence across the full spectrum of prevention and treatment, care and rehabilitation in order to help us combat these diseases. Human resources for health are extremely critical in the delivery of health services. Since the onset of devolution, county governments have prioritized stepping up their human resource for health capacity, both in terms of numbers as well as skill sets. We need to continue asking ourselves how we can better this area, because human resource remains central to health systems. One of our asks to our partners in the academia remains that, can we build a high-quality human resource base that is well prepared to deal with problems in this generation, in this time? The other key aspect is around medicines, technologies, commodities, and innovations. The actual things that we need to provide care to patients. We all know that the availability of health products and technologies to the last mile is critical when it comes to building a good health system. This is an area where innovations can immensely improve efficiency and effectiveness of health services. And this is something which is very relevant when it comes to innovations that can reach even the farthest of the points, innovations that can help us be more effective in improving our primary screening of different conditions. Finally, ladies and gentlemen, over the last 10 years, county governments have contributed tremendously to the health of the people of Kenya. Whether you look at it from the northern frontier counties, which had unique health and development challenges related to suboptimal resource investments, or from a perspective of large cities like Nairobi, Mombasa, and Kisumu, which had unique health needs based on the large concentration of populations in small areas, or you look at it from a perspective of any other part of this country, you will acknowledge the progress that devolution has made to our health systems. County governments will continue working with other stakeholders in fighting non-communicable diseases. We are fully committed to provide the highest quality of health services, maximize opportunity for disease prevention, treatment, rehabilitation, and care, including non-communicable diseases. Today, most county governments in Kenya invest about 30% of their total budgets to health, despite having 14 devolved functions. That's how much we care about health of our populations. Ladies and gentlemen, we count on your partnership as we walk this journey. Thank you.
Thank you, Dr. Omar. Now, The Center of Excellence, as mentioned, is hosted by the University of Nairobi, and within the University of Nairobi, it is domiciled at the Faculty of Health Sciences. I now wish to invite Professor George Osanjo, the Dean Faculty of Health Sciences, and as he comes, I would like to acknowledge yet another one of our patients, Edward Console. Edward, yes, thank you for joining us and being with us.
Thank you. Thank you very much, Deputy Director. The Associate Vice Chancellor, University of Nairobi, and also the Chair of Arua International Advisory Board, Professor Margaret Hutchinson, who is today representing our Vice Chancellor, Professor Stephen Kiama, the Director General of Health, Minister of Health, represented by Dr. Murray, partners from various universities of represented from University of Ghana, University of Ibadan, Makerere University, UKRI, University of Glasgow, patients and patient advocates and carers, members of faculty, students, distinguished guests, good morning. My name is George Osanjo, Dean, Faculty of Health Sciences, University of Nairobi. And this morning, I am extremely excited to be here on the occasion of the launch of the Arua Center of Excellence for non-communicable diseases. As has been demonstrated indeed by the short video clips we have seen, non-communicable diseases is a present and clear problem for Kenya, for other countries in Africa, sub-Saharan Africa, in the low to middle income countries, generally across the world. Faculty of Health Sciences, we are based at the Kenyatta National Hospitals, and non-communicable diseases there represent nearly half, slightly less than half of all hospital admissions, and it's responsible for millions of deaths annually, most of them, and quite a number of them, premature deaths, sadly, in the low to middle income countries that have a higher proportion of those deaths. Faculty of Health Sciences, we are based at Kenyatta National Hospital, one of the hospital that was mentioned actually in the video. I do hope that you'll have also opportunity to visit our campus. We are one of the 10 faculties of the University of Nairobi, about the third largest. We train doctors, nurses, pharmacists, dentists, medical laboratory scientists at the undergraduate level. And at the postgraduate level, we have about 70 programs composed of masters, fellowships, PhDs. So we have a large catalog of trainings. And we are indeed very glad to be associated with the Arua Center of Excellence. And its mandate is indeed clearly linked to the mandate of our Faculty of Health Sciences in training of healthcare professionals. And we note there that Arua Center of Excellence for NCDs is going to be involved and is already closely involved in training and capacity building for master's students, the fellows, as well as PhD students, and that some of the awardees are here. We are also involved in research, and we have a broad array of research, both in communicable and non-communicable diseases. And I'm glad that our colleague from University of Wits, yes, Witwatersrand, okay, I mentioned this. Sorry, I didn't mention you earlier, but yeah, we acknowledge we work with Wits very closely. And there's that really clear connection between non-communicable disease and communicable disease, and that intersection cannot be ignored. And I know many of my colleagues say, usually we have these communicable diseases, but what sometimes ends up killing a patient is infectious disease. So we must also be alive to that intersection. We are glad that the Center of Excellence is greatly going to contribute to mentorship of students, researchers, some of whom are here and also going to participate in the forthcoming platform. We are happy that through this Center of Excellence, we are forging links across Africa, South-South interaction, and also with partners from Western countries, notably University of Glasgow, UKRI, and other partners. So this day, today, mine is to say that I'm very glad and warmly welcome you to the University of Nairobi and Faculty of Health Sciences as well. We work very closely, as you've seen, with the Faculty of Arts and Social Sciences, where we are currently and where the Deputy Director comes from. Well, the Director comes from the Faculty of Health Sciences. So we are also truly multidisciplinary, and we will be happy to be joining with the other hubs, the other spokes, as we work together to solve some of these key challenges. So with those few remarks, I would like to take this opportunity to welcome our Associate Vice Chancellor, Professor Margaret Hutchinson.
Thank you very much, our own Dean, Professor Osanjo. Indeed, the Faculty of Health Sciences is an anchor faculty within the University of Nairobi. Today, I will wear maybe 3 hats, so I'll try to be very brief so that I don't make 3 long speeches. I'll speak as the chair of the International Advisory Board, then in my own capacity as the Associate Vice Chancellor in charge of Research, Innovation and Enterprise, and then later on as the Vice Chancellor of the same university. So the chief guest for this great milestone of launching of the Arua Center of Excellence for Non-Communicable Diseases, Dr. Patrick Amoth, here represented by Dr. Ephanthus Mare, our Vice Chancellor, Professor Stephen Kiama, who had to step out of the university today, the Arua Secretary General, Professor Ernest Ayete. I was hoping to hear his voice online. The speaker who has just spoken briefly, from the Council of Governors, Dr. Emmanuel Wamalwa, we appreciate you very much, as health is a devolved function in Kenya. I have mentioned Professor Osanjo, our donors from UKRI, our partner institutions, universities from across Africa, and the Arua family, Your Excellencies, other distinguished guests, both physical and those online, colleagues, friends, good morning, almost good afternoon. So before I go far, may I first convey the warm greetings, congratulatory messages from the members of the International Advisory Board. They are so excited that this milestone has happened. And as we spoke with a few of them, that we are reminded that, as John Maxwell spoke, that everything rises and falls on leadership. And so at the earliest opportunity, may I celebrate Dr. Fred Bukachi and Dr. Ann Kamau, who after a small challenge of starting the center, put in their best, their commitment, their passion, above everything else that they do at the university. And so as the Associate Vice Chancellor, I'm so proud of this team that has then reignited the passions from the other universities, and I'm happy that we are ready to go. So we've already had the milestones of what they have been able to achieve since 2018, and more in earnest since 2022. Indeed, it's a great milestone, and so we are very happy as a university to host the Arua Center of Excellence for Non-Communicable Diseases, also recognizing that the Arua is a very special alliance by Africans for Africa, with the international community supporting us. So from the north part of Africa to the west, to the east, even to the south, we are together to deal with this challenge that has been very well articulated by previous speakers that really face our communities. So the journey has not been without challenges, but today we stand tall that those who go through challenges then come out purer than gold. And so we are looking forward to real actualization of the objectives, the desires, and the vision for the center. So I'm aware that after the launch, there will be a follow-up symposium in Naivasha, Kenya, where the participants from the partner institutions and universities and other invited guests will share more about the research and the activities in the area of prevention, early detection, and control of non-communicable diseases. I'm hoping that these discussions will help us to chart the way forward for the next phase of the center's activities, but more importantly for the continent of Africa, because whatever will come out of there has to inform policy, to inform programs, and to inform how we deal with these silent but very dangerous killer non-communicable diseases. So the University of Nairobi, as under the Research, Innovation and Enterprise Division, has given its total commitment to support the center and its partners across the globe so that we can look forward to greater working together of the universities, that we can achieve what we have set to do and impact communities in a very transformative and yet sustainable manner. So with those few remarks, then allow me to read the speech of the Vice Chancellor of the University of Nairobi and then invite the keynote speaker for today's launch of the Center for Non-Communicable, not just a center, but Center of Excellence. So ladies and gentlemen, distinguished guests, these are the remarks of the Vice Chancellor, Professor Stephen Kiama, during the launch of the Arua Center of Excellence for Non-Communicable Diseases this day of the Lord, the 6th of December, 2022. So the chief guest and all protocols observed, as I had indicated before, I want to thank you for finding time to attend the launch of the Arua Center of Excellence for Non-Communicable Diseases that is hosted by the University of Nairobi and is one of the 13 Arua Centers of Excellence that are held across African universities. The center has been articulated to be run on a hub and spoke model and is a partnership between high research-intensive universities in Africa. As articulated earlier, I will not read all of them, but just to mention that those universities have committed to doing their part in ensuring that the center grows, develops, and actually achieves its mandate as articulated by the speakers from the various universities. The center also, as you have heard, collaborates with UK partner universities, among them University of Glasgow and Leicester University. The center was started in 2018-2019, and the activities kicked off in April 2020, but the implementation challenges that I have mentioned, both management but also in COVID-19 pandemic. Nonetheless, as I have mentioned, the center has kicked off well under the very able leadership of Dr. Fred Bukachi and Dr. Ann Kamau, of course, with the participation of the partner universities, because without them you can have great leaders, but if there's nothing moving from the heart of the matter, then it won't achieve much. The center aims to become an NCD Center of Excellence in research and capacity building in the prevention, early detection, and also the control of NCDs in the African region, while focusing on different population groups. In this regard, the center is geared towards building research and skills capacity for students and faculty, and I want to appreciate in a very special way the presence of our wonderful students who are here today. We want to recognize in a very special way, and also the faculties from both the Faculty of Health Sciences and also the Faculty of Arts and Social Sciences. This includes undertaking NCDs, scoping studies and mini grants, hosting webinars and annual NCD symposia, and participating in the Arua biannual conferences. At the same time, the center is continuously expanding, collaborating, networking, and strengthening relationship with the Arua and non-Arua African universities and UK partner universities, as well as research institutions, regional and international organizations, key government agencies, the private sector, civil society organizations, and strategic partners in Africa, UK, and beyond. And it was mentioned earlier that the Vice Chancellor attended the Arua and the European Guild Universities VCs meeting in South Africa just about a month ago. And the partnership is growing also with the UNA Europa, and so Arua is very well placed to be in the league of the research-intensive networks globally. So the Center of Excellence is built around the idea that collaborating among African universities and international partners would make grant applications stronger and easier to fund. Therefore, a major preoccupation of the COE is the application of collaborative research grants. The center is also continuously seeking and exploring capacity building and training opportunities for students and also for faculty, including exchanges between different universities for both staff and the students. As a university, we want to thank the Arua Secretariat led by Professor Enes Ayete and the UKRI and the Global Challenge Research Fund for providing the initial grant to the center through the Capacity Building Program grant. And its partners from Makerere, University of Ghana, University of Ibadan, University of Wits, as well as the University of Glasgow and Leicester universities, we appreciate you deeply once again. We look forward to further and enhanced collaboration, deepening research in the areas of NCDs, prevention, early detection, and control. Now, going forward, the university, through the center, plans to hold regular NCD forums with practitioners and policymakers, support engagement between academia, research, and the public, as well as spearhead NCDs, which are community-led research initiatives focusing on those areas of focus. Ultimately, the partner universities and the center aspire to contribute towards achievement of the Sustainable Development Goals, especially the SDG 3 on good health and well-being, and to having a greater connection between research, practice, policy, and public engagements with the aim of having a healthier African population and leaving no one behind. So I want to thank you for your kind attention, and may I now take this singular opportunity to invite our keynote speaker, chief guest for today, the representative for Dr. Patrick Amoth, who we had said today is Dr. Emmanuel Wamalwa. Dr. Ephantas Mare. My apologies. will be welcome to come and give us the keynote speech, and then we proceed with the opening of the center. Thank you very much.
Thank you very much, Professor Margaret Hudson, for that very warm welcome. Let me first of all start by recognizing the presence of the representative of Vice Chancellor, University of Nairobi. Fortunately, the same person who have introduced me to the congregation, Professor Margaret Hudson. I also want to recognize the presence of Director Arua, representative of the Chair of Council of Governors, Dr. Wamalo, distinguished delegates who are with us today, development partners, civil society, the media, students, ladies and gentlemen, good morning. Good morning. Thank you. You've sat for so long. Yeah, as in the word of NCD we say, when you sit too long, you are inviting NCDs. Yeah, but since I'm the last speaker, if I was somewhere in the middle, I would have requested you to stand up and stretch a bit. But that notwithstanding, hope we'll do that very, very soon after my speech. My names are, once again, Dr. Fantas Mare from Ministry of Health. I am here today to represent the Director General, Ministry of Health, who was not able to join us today. He was very, very much willing to be here in this forum. I was with him up to late in the evening yesterday, but unfortunately last night he lost his mother, who was in ICU, and therefore, that being the case, he was not able to join us today, and therefore he requested me to come and give his remarks. However, before I do that, allow me to say one or two things. Being the head of Department of Non-Communicable Diseases within the ministry, I know during my invitation, the Director Arua, Professor Bukachi, had requested me to say one or two things, and I told him it will be a breach of protocol if I was to come and give some remarks and then my director would come and do so. However, since today he has sent me, I have now his powers, and also therefore I can say one or two things as far as NCDs are concerned. Maybe from the word go, I would want to say that health services in this country are devolved, and therefore we have two levels of government for the sake of our visitors. We have the national government and the county government. At the county government, which were very ably represented here by my colleague Dr. Wamala, that is where we have the rubber meets the road. That is where service is delivered. At the national level, ours is to provide direction through policy development, capacity building. We also provide technical assistance to the counties. I would want to say, for us in the ministry, the establishment of this Center of Excellence is a major blessing to us. More so when it comes to the issues of policy development, since whatever policy we would want to come up with at the ministerial level must be guided by research, or in other words, must be evidence-based. I know there before we have been having a lot of problems when trying to develop policy document and also management guidelines. But we have always depended on the academic institution. And I know my first time to meet Professor Bukachi is when we were developing one of the conditions guidelines. So today, Professor, I want to say I'm so grateful that things have taken this direction. And then whenever we want to come up with a document, we shall now be coming straight to this center of excellence. So thank you very much, and congratulations to the University of Nairobi for taking this bold step. I think us as the department and the Ministry of Health, we are very proud of this. Nevertheless, let me say one or two things about non-communicable diseases. Just like any other low and mid-income countries, we are, as a country, we are grappling with the rising burden of NCDs. And this is a trend everywhere, globally. As you might be aware, 41 million deaths occur each and every year because of NCDs. And of these 41 million deaths, most of them, we have quite a number of them which are premature deaths. And of the 41 million, we have 15 million of them being premature death. And when I talk of premature death, those are deaths of individuals between 30 and 69. So when you die below 70, that's a premature death. I know those who deal with pediatric and the Faculty of Health Science, they might tell me that is not correct. But that, as per the WHO definition, that is the way it is. In Kenya, as the head of health faculty said, half of our admissions are attributed to non-communicable diseases. Of all the deaths in this country, 42% arise from non-communicable diseases. However, here is the rider. When it comes to reporting or data management for non-communicable diseases in our country, we are not doing very well. Although we are putting very purposive efforts to make sure that we capture data for non-communicable diseases by developing very robust digital platform to capture this. However, for now, the reporting rate is just about half. And those figures we are talking about are largely estimate. And it is believed that non-communicable diseases account for more than what we are reporting. And therefore, the importance of this center we are about to launch today. And therefore, as a ministry, there was no way we would have, our presence would have been missed in this forum, because I don't know whether, if we missed, I would call Prof for another guideline development meeting, and he'll agree to come. I'm also very closely associated with your deputy director. Yeah, we met somewhere in life, and she was, when I was trying to become a better academician, and I went up to a certain level, and she really supported me. I've never forgotten that. So there was no way we would have missed this forum, and we want to assure you of our support. Once again, thank you very much. Having said that, allow me now to go through the remarks of Director General. Starting now, all protocols observed. I am delighted to join you today. Allow me to get my glasses. My sight is also disappearing because of age. I repeat, I am delighted to join you today during the launch of the African University Research Alliance Center of Excellence for Non-Communicable Diseases. Allow me to commend the University of Nairobi for convening this wide representation of partners, a clear indication of momentum and interest on non-communicable diseases research is generating in African continent. Non-communicable diseases are on the rise globally and pose a new pandemic threat to the population, exerting immense pressure to health system. In the developing world, it is noted that there is a double burden of communicable disease such as HIV, TB, as well as rapidly rising prevalence of NCDs. In Kenya, 42% of mortalities are due to NCDs, with 50% of hospital admission arising from the same spectrum of illness. Of the 42% of mortalities associated with NCDs, half of them are due to cardiovascular conditions and cancers, and therefore the need for us to put some slight emphasis on those two conditions. The rising burden of NCD is largely attributable to adoption of unhealthy lifestyle, such as tobacco use, unhealthy diet, insufficient physical activity. Just as we are doing today, we are just seated for those very many hours, harmful use of alcohol, and exposure to environmental pollution and toxins. The COVID-19 pandemic further worsened the plight of persons living with NCDs, given their increased vulnerability to severe disease and other COVID-19 complications. As you might be aware, the mortalities or death associated with COVID-19, over 70% of them had either diabetes or hypertension. And therefore, that very important relationship, that is a point of very, very important relationship between infectious disease and non-communicable disease. And therefore, the need for us to give priority to NCDs, because in our African regions, the NCDs have not been accorded the right position. Yeah, ladies and gentlemen, our shared health aspiration is to attain the Sustainable Development Goals. Considering that most NCDs affect individuals at their prime age, the burden of these diseases is compounded and carries significant financial consequences to individuals, families, and society at large. I think that was well indicated by those two patients who talked. However, I wish to comment that one of the patients said that the NHIF does not cover cancer. Yeah, I think cancer is well covered by NHIF, although not, I would say about 75%, not all the basic parts of the management are covered, but in the aspiration of universal health coverage, it is an aspiration of the ministry to have everything in NCDs, and especially in the field of cancer, covered. And therefore, we are working with the stakeholders to make sure that we have very, very comprehensive packages for cancer. And I'm happy today, I've even noted the presence of the chair of NCD Alliance Kenya. And NCD Alliance Kenya brings together all the actors in this field of NCD, Dr. Zipora. Thank you very much for having joined this, and you can bear me witness that we are doing a lot when it comes to NHIF packages. Indeed, NCDs are estimated to decrease household income by 28.6% in Kenya. Further, Households affected by NCDs are 30% more likely to be impoverished than households affected by communicable diseases in Kenya. In the year 2016, NCD led to an estimated Kenya shilling 230 billion in economic losses due to direct medical expenditures, indirect productivity losses, and premature mortality, equivalent to 3.4% of the GDP. By the year 2030, it is expected that economic losses due to NCD would have surpassed 500 billion Kenyan shillings, and therefore the need for us to act at the right time. NCD are therefore not only a public health concern, but also an economic concern as well. It is for these reasons that Ministry of Health has developed strategies to mitigate the rising burden of NCDs. The goals of this strategic plan is to ensure a reduction by 1/3 of premature mortalities due to NCDs by the year 2025. We are just 3 years away. So we need to reduce our mortality due to NCD by 1/3. But I can assure you, they are rising. We are not reducing. And therefore, we need to review that statement. The first pillar of 2021-2022 to 2025 NCD strategic plan, whose goal is sectoral and multi-sectoral partnership, remain the mainstay of bringing on board all the state and non-state actors on this arena. The Arua NCD Center of Excellence is welcomed as a major stakeholder and a game-changing resource in the region, reaching out to other centers in the neighboring countries. The Ministry of Health looks forward to a stronger working collaboration with the University of Nairobi and other teaching institutions to work the NCD control and prevention journey together. Ladies and gentlemen, as per the third pillar of the strategic plan, which aims to strengthen the health system response for management of NCDs, we hope the Center of Excellence for NCD will not only cater for high-quality service provision, but also provide skilled human resource as an integral care model for persons living with NCDs through capacity building. And I'm happy to note one of the core mandates for the Center of Excellence is to capacity build and also research. Finally, the fourth and fifth pillar of the strategic plan, which speak to advocacy, communication, and social mobilization, as well as NCD surveillance, research, monitoring, and evaluation respectively. We are cognizant of the great role the Arua NCD Center of Excellence play in generating data, monitoring, and evaluation activities for NCD, and the pivotal position it will occupy in the research space and how it will shape the policy implementation environment, not only in Kenya, but also in the region. In the year 2018, in keeping with the World Health Organization best practices, the country established NCD Intersectoral Coordinating Committee, which is a multi-sectoral coordinating organ. One of the technical working groups formed under this is the Research, Monitoring, and Evaluation Technical Working Group that is tasked with coordinating and organizing research efforts across the NCD space, and is composed of various states and non-state actors with provision to co-opt more members at deemed fit. I think to this effect, for us in this space, our TWG, our Technical Working Group for research, monitoring, and evaluation has gotten a great partner, and we shall be reaching to this Center of Excellence to provide leadership when it comes to research. I think since we developed our strategic plan this year, we did our evaluation, and where we performed worst was in the area of research. I'm sure if this center had been launched, we would have been ranked that low in terms of research. Ladies and gentlemen, As I conclude, I would like to once again recognize and appreciate the important role played by the academia in improving the lives of our people. The Ministry of Health and our partner congratulate the University of Nairobi on this momentous occasion during this launch. We wish this Center of Excellence great success in the region and beyond, offering our support to the noble cause and looking forward to a fruitful relationship locally and in the region at large. Finally, ladies and gentlemen, as we continue to meet our global and respective nations' obligation of providing preventive, promotive, and curative health, which includes rehabilitative service of the highest possible standard, I want to urge all of us present here today to assume responsibility for our own health as halting the burden of NCDs begin with individuals and choices they make. That's very important. For NCDs, our individual choices we make are very important when it comes to the diet, physical activity, risk factor mitigation, smoking, harmful use of alcohol. At this juncture, it is my pleasure and duty to officially launch the African University Research Alliance Center of Excellence for Non-Communicable Diseases. Asanteni sana na Mungu wabariki. Dr. Patrick Amoth, Director General, Ministry of Health. Thank you very much. I'm allowed to sit now.
Fantas, Marie, thank you so much. We've walked a long journey. I'm so pleased to see you here. Continue with this journey, and we pray that God will continue to walk with us and to give us the strength. Now, we are coming close to the moment, and I humbly invite Dr. Frederick Pukachi, the Director of the Arua Center of Excellence for Non-Communicable Diseases, to take us through the launch and the final moment. Dr. Pukachi.
Good afternoon once again. Oh, it's all still good morning. We will have a short session to be able to go through an additional short program for the launch. It's my pleasure to welcome our Associate Vice Chancellor, Professor Margaret Hutchinson, on behalf of our host, the Vice Chancellor, to lead us through this process. And I'll be giving you a few more instructions on how you join into this brief session that will take us just about 10 minutes. Professor, welcome. May I invite all our guests seated in the front row to come and join us on the stage so that we can go through the last session. May I invite all of you? Yes, you can use both sides to get onto the stage. And I'm informed we need to invite our caregivers and patients. There were, I think, 4 of them in the audience. If you may join us. University of Lagos representatives, so you are here. Please do join us. NCD Alliance I think we have two representatives here, Dr. Zipporah Ali and Professor Gerald Yonga. You can join us on the stage. I have called. All right, Professor, will kindly lead us. Professor Hutchinson, you may press that button.
Ladies and gentlemen, this is the day. You are so quiet.
Please be upstanding to join in the event. Please be upstanding.
Okay.
Yes. Please join us in counting. 7, 6, 5, 4, 3, 2, 1.
Long live Arua. Long live the Center of Excellence for Non-Communicable Diseases. Long live Africa. Long live our partners from across the world. Thank you.
Thank you very much. Thank you very much. We are now officially launched. Could you clap for us again? There's going to be a photo shoot for those who are already on the stage. The other ones, please, you may sit. We're going to give you further instructions on what comes next. Thank you very much.
So thank you. We are really grateful, and some of us very excited that we are getting here. Professor Nzioka, I know you should have been here, but we honor you and we appreciate the journey that you've walked with us. Dr. Muriithi, we appreciate you. So I'll make some announcements. First, it's really to thank all of us for being part of this launch. It's an exciting moment for us. Allow me to begin with thanking the Minister of Health, Representative Dr. Male. Thank you so much, and please send our greetings to Dr. Patrick Amuth. We truly do appreciate. Professor Hutchinson, it's been a journey. No words to thank you. Truly, truly appreciated. And also, Professor Kiema, please send our greetings and our appreciation. Professor Osanjo, George, I thank you so much. You've been so supportive. You're new to us. We've not seen, really, we have no word to thank you. We truly do appreciate all the support that you've been giving us, and we promise you we shall do our part. Now, Dr. Himani Amano, the Council of Governors representative, we want to be part of you. We promise to be part of you. When you need us, we'll be available. As I commit, the Vice Chancellor and Professor Hutchinson as the university that will work with you, will work with you. And I have our blessings, and we shall be part of you. We'd really like to be part of you, to just listen to the citizens, listen to our public, and just know what we are going through in the area of health and the area of non-communicable diseases. Would like to walk that journey with you, not just here in Kenya, but also internationally as engaged in the region. We were supposed to be joined by Professor Ernest Ayer. He's been really part of us. He has given us immense support. He was here in August. Unfortunately, technology failed us, but we still will extend our appreciation to him as a university and as a Arua Center of Excellence. Truly, truly appreciated whenever, but we'll find a way of reaching out to him. Oh, Professor, please say a word. Please let's allow Professor to say something. Professor, please say something. Professor Yet. While he tries to Robin, I'll still give him a chance. And please interrupt once you're able to. I would want to appreciate to our guests, our patients, our brave patients. They came here to be with us. We took their time, sometimes getting them from hospital to just be with us. We truly don't take that for granted. We appreciate you, and we'll continue this journey to work with you and with other patients as we move along. And the caregivers, the invisibles, truly, truly appreciated. And again, we'll form a community of caregivers together. Group, just please go ahead, Professor Wade.
Yes, thank you very much. I'm sorry for joining you late. I was giving a talk here. I'm very pleased to see that the Arua Center of Excellence for non-communicable diseases is finally launched. It's been, as you have said, a great journey. We've had a number of challenges, but I'm extremely pleased that finally we've been able to overcome all of these challenges so that we have today a very, very good launch center. I'm very pleased with the work that is going on there. I'm very pleased with the roles played by the DDC Research, Innovation and Enterprise for the University of Nairobi. I'm very, very happy that you've been able to do this. And I wish you very, very well. And God will continue to support you. Arua will do everything possible to ensure that the resources that we need to operate can be found. We'll give you all the requirements, all the support that will enable you to do that. So as you go through the end of the ceremony, I would like to wish you all the very best and congratulate you for this achievement. Thank you very much.
Thank you, Professor. We owe you a lot. You are part of us and you've worked with us this journey. Now, to the International Advisory Board members, I know quite a number of them are online. Receive our gratitude. We truly appreciate your support and guidance in this process. Now, we have our students. Some of them are not able to come because of classes, but we do appreciate that you took time off from your classes to join us. The university community, both from the University of Nairobi, also have representative from Kenyatta University. We truly do appreciate your joining us. To our partners, we don't take you for granted. University of Wits, University of Ibadan, Makerere University, University of Ghana, and our new friend, University of Lagos. We look forward to working together again this journey, and we support each other. Our UK University partners, University of Glasgow, special gratitude Professor Pascal Mafia, Professor Paul Galside, and Christian, who also have been part of us since we began the center, truly appreciated. The University of Leicester, Andrea Cooper, again, truly appreciated for your support. We thank our funders, the QRI and GCRF, and again, the Arua Secretariat, who have really given us immense support in this journey, financial and moral support. And to the University of Nairobi, who also partly supports this center financially, we really do appreciate, again, our gratitude. We really send our gratitude. To the planning committee, led by the ABC's office, truly appreciate Maria, wherever you are in your team. We really do say a big thank you to you. Helen, no way of thanking you. Thank you so, so much. ICT, Brian Oma, VC's office. VC's office. We do appreciate. Tuka, wherever you are, our gratitude. We'll never be able to pay you for what you've done and how you've supported us. We truly do appreciate. Security, catering team, protocol, truly appreciate the support that you've given to us. On your side here, we have another invisible group, our sign language interpreters, truly appreciated. We thank you and hope that you be part of the Arua Center of Excellence, because we need to speak to those who are invisible and never reached even with information. So truly, we welcome you to join the center and to be part of us. Behind the scenes, there's a team of very young people led by Pascaline Basil. Pascaline, we have never been able to thank you, but I hope one day we'll be able to thank you. Thank you so, so much. Dennis, Henry, Joseph, Johnson, truly we appreciate you and we thank you for all the support that you've given us. You made so many sacrifices. Again, we have the steering committee member. Professor Nzioka, you've been part of this journey for a long time. Dr. Awero, Mary Kinoti, I'm not sure whom I've left. We really do, Dr. Murithi, truly we appreciate your support. You made a lot of sacrifice to make this a success, and we really, really thank you. And finally, to Dr. Bukachi, you can never achieve without a good director. So we really, really appreciate you for everything that you've done, and we will give you a full support. Now, as we conclude, I would like to invite all of you to lunch at the VC's parlor. The VC's parlor is just up this way, so we welcome you for lunch. The exhibitions out here from students, showcasing part of the work, and we hope that going forward we'll even showcase more. And also, just again, once again, from my end to thank you. I'm not sure, Pascaline, whether there's any other announcement. Yeah, we have some gifts that you're going to give to the guest speakers and the patients and the caregivers. So we'll talk to Pascaline as we move out. So we'll have some, Helen will have some photographs out here as we get out. So Helen is going to guide us in this. So from my end, thank you so, so much. We do appreciate you and look forward to further engagement with you. God bless you. Now, before we close, may we have the national anthem? The choir is not here, or it's ICT. As also, I invite Reverend Hosea Mite to give us a closing word of prayer. Professor, you can come up. Reverend Mite?